All right, so our next speaker is Dr. Azlan Ahmad who's the manager for the MRI under Century and also a senior lecturer at the Department of Biomedical Imaging. So Dr. Azlan will be talking about how MRI works and what it can do. So I'll pass the floor now to Dr. Azlan. Dr. Azlan?
Thank you, Dr. Anwar, for the nice introduction. Assalamualaikum and good morning, everyone. My name is Dr. Azlan bin Ahmad. I'm a lecturer in medical physics at the Department of Biomedical Imaging. And in this talk, I will explain the basic principle of how MRI works. And then I will discuss its advantages and over other imaging techniques. And finally, I will give some example of its application. Okay, first I would like to introduce about the components of MRI machine. So these are the main component of an MRI. So in MRI, we have the main magnets, RF coil, and gradient coil. So the main magnet is used to produce the main magnetic field or static field, and then the RF coil is used to produce radio frequency fields, radio frequency magnetic fields, and then the gradient coil is used to produce the gradient fields. Okay. Next, I would like to talk about how these different types of magnetic field are used to generate images by using MRI machine. But before that, I would like to describe the source of MRI signals. So all subatomic particles such as protons, neutrons, and electrons, they have a property, fundamental property called spins. So these spins, it creates a weak magnetic field, like bar magnets, small bar magnets, called a magnetic moment. So MRI uses the nuclear magnetic moment of atom to get the signal and generate images. So in clinical MRI, the most common atomic element used is hydrogen-1 protons. So in principle, we can also detect signal from other isotope, for example, carbon-13, phosphorus-31, and then helium-3, for example. However, in the clinical MRI, the detection is tuned to only detect the signal from hydrogen-1 nucleus. So in the human body, we have a lot of abundance of hydrogen-1. Okay, they are part of water molecules and also lipids molecule. So so what happened when we put a patient inside the scanner? Okay, and then when we expose it to the main magnetic field, so there are two things that will happen. Okay, to the nucleus of hydrogen-1. Okay, first, it will cause the hydrogen-1 nucleus to precess. Okay, like a spinning top. Okay, like this. So outside the MRI, it does not precess. However, when we place the patient inside the MRI machine, the proton will precess with a certain rate. We call this rate as the Lamor frequency, and it is directly proportional to the strength of the main magnet. So the higher the main magnet, the higher the precession rate. So the second thing that will happen when we place the proton inside the main magnet, so the direction of the magnetic moment will tend to will align to the direction of the main magnet. So outside the MRI, they will be randomly oriented. So the direction will be 360 degrees everywhere. So there will be no net magnetic moment. Okay. So inside the MRI machine, slightly there will be more protons in the direction of the main magnetic field. So it will create a net magnetic moment, and this net magnetic moment will create a macroscopic magnetization, where the symbol I use here is M. So at equilibrium condition, So if you do not excite, do not give it other other external. We do not excite it. So this M, this macroscopic magnetization will be in the direction of the main magnetic field B naught. Okay. So this M, this macroscopic magnetization is too small to be measured directly. So in order to measure it, we use RF frequency, okay, radio frequency pulse, okay. So in order to do that, this RF frequency must be in resonance with the Larmor frequency of the precession of the nucleus, okay. So in resonance means the frequency of the RF must be the same as the frequency of the precession of the protons. Okay. So after we apply the RF, so it will rotate the microscopic magnetization towards the XY plane. Okay, perpendicular from the Z direction towards the XY plane. So it will create microscopic magnetization in the transverse plane. Okay, so this microscopic and the transverse plane will induce a current if we place a coil like this. If we place a coil like this, so it is like the dynamo, principle of dynamo. So the magnet rotated, so it will create current inside the coil. Okay, that's how we detect signal from the magnetization. So the third component is the gradient magnetic field. So this gradient magnetic field are used to generate gradient field. So this gradient field are used to create spatially linear variation in the total magnetic field at different positions. For example, without any gradient, so we do not apply any gradient, the static magnetic field, the B naught, will be the same in all the location here. For example, at the neck and at the tip of the head will be the same magnetic field. However, if we apply gradient, so the magnetic field will be different, linearly varied from one position to another position. Okay. So since the magnetic field are different from one position to another position, to the Larmor frequency of the proton also will be different. So we can make it unique by applying this gradient field. So we can use this information to encode the spatial information of MRI signals. So the signals are sampled and stored in a raw data space in computer. And this raw data space are called the K space. So each signal, they are encoded with different combination of gradient. For example, this combination of gradient, we get one signal, and then we increase the strength of one of the gradient. We get a unique information in the signal. Okay. So after all the signal are collected and filled in the K space, it is converted to an image by using a mathematical technique called the Fourier transformation. Okay, like this. Okay. Next, I will talk about the advantages of MRI compared to other imaging modalities. So one of the main advantage of MRI is does not use or produce any ionizing radiation, for example, X-rays or gamma rays. So it does not have a potential side effect, for example, cancer or genetic mutation. Okay. So in terms of radiation, it is considered as a safe imaging technique. Okay. So the second advantages of MRI, if you compare with CT scan, okay, so it has excellent ability for soft tissue differentiation. For example, here in CT, it's quite difficult to see the difference between white matter and gray matter. However, in MRI, can be clearly shown, the difference between white matter and gray matter, for example. Okay, and the third advantages of MRI, so it can produce different types of images. Okay, uh, for example, here the white matter is brighter than gray matter. In here, the white matter is less bright compared to white matter, and so on. And some technique we can suppress the fluid, for example, or we can suppress the fat. Okay, uh, so we can do this by using different combination of imaging parameter, or what we call as path sequences. Okay, uh, so MRI basically is a very flexible technique. So these are example of types of images that can be produced by MRI. For example, this one, the most common type of images it can produce, the T1 weighted image, T2 weighted image, flare image, or T2 star, GRA, and proton density. So each of these technique, they produce different type of tissue contrast. Okay. Um, So another example of application, okay, that can be produced by using MRI, for example, Dixon method. So Dixon method can produce, for example, um, image which shows fat only signal, okay, or water only signal, okay. Uh, and then DWI, for example, diffusion weighted imaging. So it is a technique that that is used to measure the random movement of water molecule in tissues. Okay, so it can show the present and extent of lesion, for example. So for example, this the brighter the signals here, it shows that um, maybe more diffusion of water. The darker the image, less diffusion of water in the tissues. Okay, and then MRI also can, if we suppress, for example, the water signal and fat signal, we can also measure other molecules or other chemicals. Okay, for example, in the brain. Okay, for example, we can also measure as long as they have hydrogen one, okay, in their molecule, NAA, for example, glutamine, and so on. Okay, and then by using a technique called Bowl fMRI, we can measure blood oxygenation level in the brain, okay, in response to a task. So we ask the subject to do something, for example, to see a certain object, and we can see which part of the brain active by using this technique. Okay, we call this technique as fMRI, okay, functional magnetic resonance imaging. And then um, uh, we can extend the diffusion weighted imaging technique to generate tractography. Okay, so tractography is used to reconstruct white matter tracks. Okay, so we apply the diffusion weighted imaging. We acquire in uh, many direction. For example, 64 direction, and then we can see in which direction the water molecule actually diffuse. Okay, so we can use that information to reconstruct the white matter tracks, for example, in the brain. Okay, okay. In summary, uh, the main source of signal in clinical MRI is from hydrogen one nuclei of water and lipids molecule. So MRI, it consists of three main components: the main magnet, RF coil, and the gradient coil. So the main magnet is used to cause spins precession and to generate the macroscopic magnetization. So macroscopic magnetization is like the small bar magnet, okay, in our body. Okay, and then we use RF coil to tip the macroscopic magnetization away from the direction of the main magnet. And then after we tilt, we can use coil to create MR signal. And we use gradient coil to spatially encode the MR signal to create images. Okay, so okay, these are the main advantages of MRI. So it does not use ionizing radiation. So it produces excellent soft tissue contrast compared to other imaging modalities, and it's able to produce different types of images. Okay. Okay. I hope.
Thank you, Dr. Azlan.
Okay.
Sorry,
Thank
I'm
you.
going to have to stop you.
Okay. That's all.
Yeah, because of time. But thank you so much. Thank you.